Hi everyone, it's Dean Hutchison here from Circle Surrogacy and Egg Donation. I just wanted to check in quick, say we are good to go to start. We're going to wait a couple minutes just in case anyone else populates the room. So um, don't think you're not hearing what's going on. It's just going to be on mute for a second, and then we'll be back in about 2 minutes to get it going. All right, I'll be right back. Hey everyone, I'm going to get going. The numbers seem to have been leveling off for attendees, so I might as well just get started. For those of you that do join late or that have to leave early, don't worry, it's being recorded, so anything you miss, even if you populate a question that hasn't been answered yet by the time you leave, we will answer many, if not all of the
Dean, just having a little trouble hearing you, Dean.
Can you hear me now?
Yep, much better.
Is that better? Sorry. So as I was saying, I apologize. I had my microphone at the top of my head, of course. But as I was saying, we are recording this. So if you have to leave, you can populate any questions in the question box and we'll get to it. You can also obviously reach out to your team of anything that comes up that you have further questions on, and we'll try and answer as best we can. So thank you all for taking the time for coming. Thanks to our panel. We have with us today, Sam Hyde, our president at Circle. I'm Dean Hutchison. I'm the vice president of legal services here at Circle Surrogacy and Egg Donation. We have Amanda Harry, who's one of our managers of program support at Circle Surrogacy and Egg Donation, and Dr. Saeed Danishmand from San Diego Fertility. So we wanted to get kind of a diverse group of our staff, as well as some of the clinics we work with, to give you, a kind of overview of what we're seeing right now in this COVID-19 situation throughout the United States and the world. Just before we get going, the kind of ground rules here. You're in listen only mode, so you can't speak and you can't ask questions verbally, but there is a question box on the side, so you can start filling those questions out as soon as you want. We'll get to them probably all at the end as they came in. So as I said, if you leave and your question wasn't answered, we'll make sure a recording of this will be sent to you. So this is all being recorded as we speak. It gets uploaded to the system and should be out to you either today or tomorrow. I just want to open up by saying, obviously, we understand this is a time of major uncertainty in the world, unprecedented time. We've probably heard that word too many times in the last week or so. And we also want to recognize that all of you on this call, you've probably gone through your own ups and downs in your fertility journeys, in your path to parenthood. And then this is one last step that we need to get over, and we want to make sure we're there for you. We can assist in any way we can, pounding the doors and going through everything we can to make sure we keep your process on track and get that end result we all want. Obviously, our primary concern is always that of the safety and comfort of our intended parents, our surrogates, our egg donors, and the children to be born through this process. So we want you to know that we're working to all the best of our abilities, all hours of the day and night, to make sure we're assisting in this process to make things go forward. We're following all of the U.S. government Centers for Disease Control news. We're updating on latest news. We're trying to react as it comes in. As you all know, no matter where you are, it's evolving almost on an hourly basis now rather than a daily basis. But we're having meetings usually twice daily now as a full team. We're having our individual meetings. We're trying to work through all these issues as they come up from a team. I think we've all said it, and I'm sure Sam will say it and Amanda will say it, but it's pretty unbelievable what we've been seeing as a team at Circle, just from our internally, how people are just so involved in trying to assist in any way they can, and jumping on these meetings and reaching out to people all around the different states to assist when issues are popping up. It's a pretty amazing thing to witness at Circle as the staff does it, and I know Dr. Donishman will probably say the same about his staff. So these are kind of the major questions we're seeing. So we'll go through them, and each of us will kind of jump in where where we think it's most relevant. The first one can probably be answered both from a legal and a support staff. So I'll begin a little bit, and then I'll let Amanda jump in. But the current question is, what is Circle doing to support intended parents, surrogates, and donors? From a legal side, obviously, we're trying to find the best routes and possibilities for our parents, and that's coming in a couple different ways. Where we're seeing, possible issues is obviously travel issues. And when this first started, from a Chinese perspective, we immediately got on a big conference call. We had our PCs and our lawyers reach out to the different parents who had babies coming that may be inside or outside the ban of travel. We got, I believe, everyone there that was due through a certain stage for the births of their children from China. And then similarly, when it started to look like it was going to impact Europe, we started to reach out to people that had births within a certain window, as well as people outside of that window, to try and either get travel plans going or potential backup plans for children. From a probably more, I don't want to say minor, because nothing is minor here, but also we've seen hospital regulations change in terms of who can come into the hospital, what visitors can come in for the birth, who can be there at the birth. Can the surrogate have anyone with her or have only one person? And we're dealing with those more on a micro level, that as they pop up, working with the hospital to see if we can get any leeway. But they are situations where we don't have full control over those. And a hospital is going to make a decision what they think is best for the hospital, and it may impact your end of your journey, but they obviously will release the baby to you. It's just how that release is going to happen could be different in each case. Obviously, as questions have come in, when people have had nerves or fears, our support team has been there, and I can kind of let Amanda jump in from a coordination support, how that's been working as well over the last couple weeks or so.
Yeah, thanks, Dean. So as all of you that are listening to this call would have likely received at this point, the program coordination team has been sending regular updates to all clients on what details and information that we are receiving in regards to the coronavirus as we are receiving it. I think as a team, we quickly learned that the changes are happening so quickly. Sometimes it's even on an hourly basis that guidance is changing. So our marketing team actually was able to create a link to our website specifically for our clients that will be updated on a regular basis with all of the current information and details that we have as we've been receiving those. At this point, all of you should have received a link to that particular page. If by chance you have not received it at this point, please feel free to reach out to your program team directly, and we can certainly send that information off to you. A lot of times people question in this situation, how's our surrogate being supported? So for those of you who are already matched with a surrogate, it is important to know that our social work team is actively engaging surrogates to offer additional and ongoing support throughout all of these particular situations that we're facing. As Dean mentioned, it can be extra stressful to have some travel concerns on the surrogate side of things, wondering if her intended parents are going to be coming in, how that's going to be affected, and then of course, you know, any additional support needed through hospital policies changes, things like that. So we're definitely making sure that we beef up, so to speak, the support that our surrogates are receiving during this time. Egg donation team is also providing additional support to egg donors, helping them through any delays in the process, setbacks they may be facing, concerns that they may have regarding travel. And then on a final note for our intended parent support team is fully ready to speak with any intended parents that are feeling additional stressors, that need additional support, additional advice, or even just a safe place to process their thoughts and help problem solve. They are also working, the intended parent support team is also working on various support groups that we can invite intended parents to come together for individuals who are experiencing like situations, and meet as a group so that they can talk about how problem solving, you know, ways to kind of cope with the factors that we're facing on a daily basis.
I can add in there too that particularly, I mean, I think everyone, not just the legal team, but all different facets at Circle have been engaged throughout the community, not just you know, with our parents and our local attorneys, but I happened to help assist in running a webinar the other night for all surrogacy professionals around the country and world, and we had over 300 attendees with an amazing panel talking kind of what's going on, what to do, but comments from throughout the country of people, and it is an amazing community even outside of Circle that you know, people are ready to lend a hand and assist if, you know, any issues come up or anyone needs help around the country. So we've also reached out to you know, politicians and other people that if, you know, people are struggling to travel or get places, you know, can we get any help from on the outside? So we're trying to use everything we have at our capacity just to assist in case, you know, we need further assistance down the line. So some of the questions have come up, and you know, a lot of you on this call may already been in touch with your teams and with your clinics, but you know, how may COVID-19 affect the IVF portion? Obviously, I'll let Dr. Danishman speak to that, who's obviously an IVF physician at San Diego Fertility Center.
Hello, everyone. It's a pleasure to be with you and to provide some information and some education during these harrowing times. First of all, I wanted to talk to you about and address some of the concerns that many of you have had in regards to COVID-19 and how that may affect surrogates or patients who are currently pregnant. At least some of the preliminary studies coming out of Wuhan University, which were published in the journal Lancet, do not provide any evidence for vertical transmission, meaning the transmission during pregnancy from the surrogate or the pregnant patient to the fetus. Again, further studies are needed. These were smaller scale studies that were done, but at least so far, we don't have any evidence of vertical transmission. And also, if you look at other examples of viral illnesses, the majority of them do not show evidence of vertical transmission, but the possibility does exist that after a child is born, there could be transmission if the child is close to those who have COVID-19 active infection, the newborn. So there was a study that was published in Lancet where they looked at a small group of pregnant patients who came into Wuhan University. And what they did was they looked at amniotic fluid, cord blood, and then once the newborn babies were born, they looked at nasal swabs and oral swabs, and they did not detect the presence of the virus in any of those cultures, which means that they felt, at least in this particular study, that there was no evidence of vertical transmission. As I said, it's a small study. We need further studies to look at the modes of transmission of this particular virus. And there also exists a possibility that after a newborn is exposed to someone who is who has COVID-19 infection, or someone who is an asymptomatic carrier, that they potentially could have symptoms as well. At least in this particular outbreak, this global pandemic, it seems like the population that is most at risk for severe symptoms and possibly severe complications have been the older population. The symptoms have been less severe in the younger population, especially in the population less than 18 years of age. Again, more studies are needed. I think we just are learning more and more about this particular virus as the days progress. The other concern that some of you have had is, does the virus, can it infect eggs, sperm, or embryos, and then later be transmitted to a patient, to the fetus? We have very good, solid evidence that there's no chance of transmission of this virus, or really any history of any virus for that matter, that can be transmitted through sperm or eggs, especially with the stringent washing techniques that all fertility centers have in place that prepare the sperm and prepare the eggs prior to creation of the embryos. So when you look at other viral infections such as hepatitis, other coronavirus infections, there's no evidence or any history of any transmission of that particular virus via sperm or eggs or embryos to another patient. So I think that from that standpoint, we have fairly solid evidence, and we feel comfortable, at least for the creation of embryos, that we're not putting our patients at risk or future children at risk. The other concern was one that was raised by the American Society of Reproductive Medicine, where they came out with guidelines and recommendations to delay treatment, fertility treatment, up until March 30th, where they will come up with further recommendations. And that American Society of Reproductive Medicine recommendation was really based on a public health concern, meaning that they wanted to reduce traffic at clinics for patients in terms of exposure. They are also thinking about the fact that in some pregnant patients, with COVID-19, the symptoms could be more severe than non-pregnant patients. And some of the medications, for example, that are currently being tested and researched, for example, a medication called remdesivir that's being produced or tested by Gilead Sciences. Some of these medications may not be available to pregnant patients and may not be indicated during pregnancy. So that was another concern, and the ASRM, the American Society of Reproductive Medicine, recommended a pause in embryo transfers at this particular point up until about March 30th, and they will readdress the situation at that particular time. So just a little of overview of the status of fertility treatment, IVF, during this COVID-19 pandemic. Needless to say that we've had an incredible team here taking care of our egg donors, our surrogates, being in communication with our intended parents, much like Circle's team. The professional nature, the empathy, and the availability and communication with intended parents, donors, and surrogates has been amazing. We're so proud of them, and really proud of being in this community of surrogacy professionals that are really coming together to help intended parents, surrogates, and donors navigate this particular pandemic.
Thanks. Thank you, Saeed. Another question we're getting a lot is, what are hospital protocols for those who recently traveled either within the US, internationally, or domestically? And I kind of touched on this, but it really is depending hospital to hospital. There's some hospitals that were allowing one parent in as kind of the support person for the child at birth. Some hospitals have even said they won't let anyone in, or if you're traveling by plane, no one can. You need to do a 2-week quarantine in the state prior to coming in. to the hospital. So it has more to do with hospital quality assurance and risk assurance, that they obviously don't want to risk bringing the virus into their hospital of people that aren't particularly, I don't want to say needed because it sounds harsh, but obviously in these situations, the surrogate is their patient, the child will be the patient after the fact. But they just don't want to, some hospitals don't want to take on that risk. I will say that in a couple cases that had initial hardline decisions of not allowing one or both parents in, we did successfully work with the hospitals, with local counsel, our coordination team, our legal team, to have a change of heart and allow both dads in at one stage. So it's rapidly changing. Where obviously your team will be reaching out to the hospital and continue to do so as we approach birth, but there has to be kind of that expectation that maybe you might, or only one of you might be allowed in at the time your baby's born. I don't know if Amanda wants to jump on that as well.
The only thing I would add additional to that is a little more detail into what you mentioned, Dean, about the program coordination team being in touch with the hospitals. I know for all of you facing a delivery soon, so I would say within the next month or two, it is a coordinated effort between the legal team, the program coordination team, social work team at the hospital. We are working to try to determine what the protocol is on a daily basis. We do see it sometimes changing on a daily basis. For all of you expecting a delivery a little bit later on, we've included some questions in regards to policies around COVID-19 to the standardized questions that we ask the hospital when we call to alert them of your upcoming delivery. The plan for the program coordination team going forward is going to be asking those questions at the time of that call, sharing that information with you, and then of course as your delivery gets closer, contacting the hospital back to determine what their policy and what their protocol is at the time that you will be delivering. So keep in mind the initial information that you receive is likely to change. Sometimes, hopefully, we hope eventually it will be for the better, but it could potentially be more limiting policies as things progress in your pregnancy.
Some questions now more based on travel. So I can say, obviously we've seen multiple travel bans now, but we were on top of the initial one with assisting parents and creating kind of a formulaic letter, particularly for international parents trying to get here, kind of detailing their situation. We actually, went out and shared that letter throughout the industry, so we weren't keeping it as our secret antidote. Because in case it worked, as we've been talking earlier, we wanted to make sure other surrogacy agencies and other people in this field, had copies of these things. So we made that decision, to share as much as can be. So, the question is, what should intended parents be doing regarding travel for the upcoming birth of a baby? Obviously, making plans, as quick as you can, having potential backup plans as well. For those that are overseas, we are, I think, trying to work through many different avenues to see if you can get visas, in a sense, to, kind of get around the bans. I don't know how that will work or if it will work, but it has worked in one case where someone was able to come in with the travel letter we provided post-ban. And then domestically, right now there's no shutdowns, but obviously that could happen too. So potentially thinking about, needing to drive if necessary, is a something to come up. But planning ahead, obviously, the best you can. And if it means coming a little earlier than you wanted to, but you have a secure place and a setup in that state where the surrogate's delivering, it's a smart option to do. I don't know if anyone else wants to jump in there. How can intended parents prepare for the baby's arrival once they arrive? I mean, obviously, very similar to what Amanda and I have been talking about with, our team will be working with the hospital as well as I'm sure you will too, as with the surrogate. Right now the expectation is at least one parent, potentially both, will be able to get in, but prepare that maybe neither could get into at least the delivery and potentially not get the child till discharge. We've also told, and I think Amanda's team has been telling parents, not a bad idea to stock up here and there on formula and diapers just to be safe. We'd be telling you to do that whether this was happening anyway, because it's always unexpected how many diapers you need on those first couple months with newborns, which a lot of us here have experience with them on the phone. But those kind of things that you wouldn't think, maybe to stockpile a little more, obviously you may want to.
And a good thing to note, and also in reference to formula, bottled water tends to be easier to mix with formula. So if you do buy the powdered option of formula, I would also look to begin a stash, so to speak, of bottled waters as well.
What if I can't make it to the birth of my baby with travel restrictions? Can the surrogate take the baby home? So this is a question we've obviously been discussing internally at Circle for weeks now, because this has been progressing since mid-January. I think obviously, and I know a lot of you that are due probably April through June have already had these discussions with your teams and legal and your PC team, but you want to come up with the best plan you can. If you have other family in the United States or friends that are either closer to the surrogate, or if you're international, they're here and they're willing to travel, that's probably the best step one. There are in the surrogacy community, we have kind of this giant list going around right now of people around the country that are willing to kind of step in and help in those situations. So there's kind of that secondary piece that there are potential people to assist in the process all around the country, in case even for domestic parents, potentially if there were domestic travel bans. I think, probably the last case scenario should be your surrogate, and that's not anything against you or your relationship with your surrogate, but it might, it might not be the best. But if you have a really strong relationship with your surrogate, and both sides understand the issues involved, and both are okay with it, it's not, if it's needed, it's there. But again, these are conversations we have. Our coordination, or our screening team and our support team has already had very long, detailed conversations on if these situations arise. They want to make sure they're, discussing this out with the surrogate and their support person, as well as the intended parents, so they understand all these issues before making that decision. It has happened in our past too. I can say, just I didn't mention, I've been with Circle for 16 years, so I've seen about as much as you can see. But we have had cases where either I don't know if you all remember, particularly about, it's probably 6 or 7 years ago, when the volcano went off in Iceland and kind of shut down European travel for a long period of time. We had some parents that were just struggling to get here, and they had a very strong relationship with their surrogate. I believe it was a second sibling journey where they had a child already, and the surrogate assisted for a handful of days until they were able to get here. Definitely, we're kind of reviewing all options just to be prepared if that happens. If I'm traveling internationally for the birth of my baby, do I have to self-quarantine 14 days? So it all depends. I mean, these questions probably came up this weekend before travel started to stop even more. But obviously, for Chinese parents, when the ban happened, they had the ability to go to countries that didn't have the ban and self-quarantine for 14 days and then come into the country. That's still an option for people if any countries are open, if they can travel from Europe to a different country that's open, spend 14 days there, and then go into the US. It's there. I just don't know how long those options will stay open. So, or if there are any left at this moment. It seems like a lot of countries are shutting down their borders at the moment. So, I think probably the best bet is going to be either to get some type of emergency visa just to go back a little, the US travel ban has some exceptions to it. They're not clearly defined, and they're not clearly implemented in the sense that we know exactly what they mean, but there is one exception to the travel ban that says if you're the legal guardian or parent of a US citizen, you can get around the exemption. It doesn't say when that parentage starts. what we did with those letters I was talking about earlier was detail the legal work that's been done in the cases where there are pre-birth orders to say, they've been adjudged a parent and a legal guardian. The due date is this date. They need to be in the United States for that birth because they're the sole parent and custodian and guardian. So that is an option. I don't know, if it will work. As I said, one of our parents who came here, I believe on Monday, was questioned when they came through customs and went into, with the letter and based on the letter and their explanation, they were allowed in. I would say, it's obviously probably safe if you get here enough in advance of birth to definitely self-quarantine in your space and just to protect yourself as well as protect the surrogate and the baby, just to make sure you don't have anything. But each case is going to be different. Similarly, someone asked if they're traveling domestically for the birth of the baby, do you have to self-quarantine for 14 days? As I said, some hospitals are requiring it, but that would be more to get into the hospital, not to, to potentially get the child released to you and leave. And I think the one that I'm thinking of that had it was if you flew on a plane, whether it was domestic or internationally, they were requiring a 14-day quarantine if you wanted to enter the hospital. So it'll depend hospital to hospital. Otherwise, there's no specific 14-day quarantine that I know of for domestic travel. All right, so other questions we've seen come in. So intended parents that are pregnant but not close to delivery, what should we be doing during this time? I don't know, Amanda, if you want to jump in there.
Yeah, I think at this point it is important for anyone who is looking at a delivery that is a bit further out to begin thinking about what your plan will be if we see some of these restrictions continuing. So ultimately, the goal and hope, of course, would be that travel restrictions would be eventually lifted and hopefully not affect your delivery. Hospital restrictions hopefully will be a little less limiting at a time of a future delivery. But I think it's important to plan for situations where that could still potentially be an issue. So if you're domestic, maybe begin thinking about a game plan for driving for delivery instead of flying. If you're international, all of the things that Dean discussed previously, as far as trying to figure out if you are unable to come into the country, what would your needs be? Is there someone that you know of in the US already that may be able to assist you? If not, sharing that information with your program coordination team, and we can help you work out a plan for anything as we get close to the delivery. But I think right now it's just important to remain in contact, of course, with your surrogate and share any details or plans that you're making with her, and continuing on in the pregnancy as normal, of course, with the idea that you're going to have to start beginning to make plan B, C if necessary.
Intended parents that are matched but not pregnant, what should I or would be doing at this time? I don't think there's anything particularly you should be doing. I think we want people to continue on their journey as much as they can in this time period. So if you're matched and doing contracts, it's worthwhile to continue that contract. Even if your IVF gets delayed, you'll be that much further ahead in the process once things begin to lift. Obviously, and Amanda can jump in too, but keeping that relationship, keep in contact with your surrogate, keep supporting her and, kind of mutual support back and forth. If you've already done with your contracts and you're waiting on IVF, and there's a delay in that, I think it's best to keep the matches alive. Neither side, even if you break or the surrogate breaks, there's no reason to, in a sense, because you can't. It doesn't mean that you can go match with someone else and speed up your process. For the most part, I think you're going to see nearly every IVF clinic, kind of put a hold on their processes until they get further guidelines from the ASRM, which Dr. Donishman was talking about.
Yeah, and I would jump in there too as well to say that since I've been at Circle, I've noticed that in times of delay, if intended parents and surrogates can increase or at least maintain their regular communication with each other, it does help get through that process and get through that delay with the limited amount of stress. If you have that open line of communication, you're still talking about just life in general, and sharing even some fears and some worries with each other. That's okay too. Just keeping that line of communication as open is really important, especially in times where we're facing some type of delay.
Let's see. Intended parents that have signed on with Circle but are awaiting a match, what should you be doing during this time? You know, same thing. I don't think it impacts you in any way to, you know, just wait. I mean, we're actually actively matching people right now. So, you know, fully knowing that, you know, maybe as we've said 100 times now, maybe the IVF gets a little delayed, but I think it's worth just staying the course in a sense. Dr. Danishman can talk if there's any, you know, certain tests that can be done from home if you are allowed out or if your clinics near you are available. But I don't think there's any reason to change your course at the moment in this process.
Yeah, exactly right. I think during this time where we're waiting for example, embryo transfers to be scheduled in the future, or for IVF cycles to start, I think we have this temporary pause in the IVF cycle treatments until March 30th, when ASRM, the American Society of Reproductive Medicine, will come out with new guidelines. We can still continue the diagnostic testing part of your journey, including, for example, obtaining genetic mutation recessive analysis. We could do that via saliva test kits that we can send you. If there are labs that are open where you can do sperm analyses locally, we could do that and get the analysis, or any blood work that we need. And of course, constant communication. If there's questions, concerns, we're here. We can organize webinars, individual Skype consultations, or consultations that we can do with you over the phone to give you further guidance and information during these times.
How can I continue to receive updates on COVID-19's impact on surrogacy? Obviously, you're part of a coordination team at Circle, so they're going to be updating you, and you can reach out with questions. As Amanda said earlier, we created a whole page on the website that's being constantly updated as more information comes in. So that's going to be a constant place. We're going to try and hold these as regularly as we can as well, so we can always come back and do more webinars. You can ask questions. We'll send out emails with information as things are happening. So our goal is to keep you as informed as possible in all those different methods, but you always have that ability to you know, check back in with us. And then the last question being, you know, will Circle be able to survive an economic downturn caused by COVID-19? I'll let Sam go further, but I can tell you I've been with Circle 16 years. You know, and Circle's been around for over 20. We've gone through multiple different economic ups and downs. We were around during September 11th in the aftermath. We were around in the 2008 and 2009 crises. So we've weathered those storms, and I believe we'll weather another storm. But I'd let Sam, as the president, speak more to that aspect.
Yeah, absolutely. Thanks, Dean. I see this question was so pertinent that it's on here twice. So sorry about that, guys. But no, you shouldn't have any concerns about Circle's economic prospects during a downturn. As Dean mentioned, Circle's been around for 25 years. I think it's actually grown every year it's been in existence. Although this year I'm a little reticent to say we'll grow over last year, but just given the current situation. But the agency is strong financially. The agency is backed by a diverse group of owners that are committed to the long-term health of the agency, and we plan on being here for many years to come. So no concerns on that one.
So I'm going to now open up the question box. So if you haven't listed any questions and you have them, feel free to do that. Okay, the first question is, I'm 24 weeks pregnant and want to attend upcoming ultrasounds. I will have to travel by air for 2 hours. Am I endangering my surrogate and her family and my child? So I would say that, you know, probably the best would not to travel there. And I know I'm not a doctor, so I'll let the doctor too. And I would potentially think that any of the clinics where they're doing ultrasounds may be as limiting as the hospitals are. So obviously you don't want to come and travel out and then find out that you know, you can't go in anyways. But I don't know if Dr. Danishman wants to jump in there.
Yes, I think, in regards to ultrasounds, obstetricians, fertility clinics have decreased the number of visits for sort of non-essential visits for patients. So really, I think that the less amount of travel would be better, but really it's kind of less exposure. So if you're pregnant, I would want to have you really abide by the social distancing as much as possible to reduce your risk of exposure to the virus. And of course, all the other recommendations that we give patients in regards to frequent hand washing for at least 20 seconds, making sure that if someone near you, has any kind of cold symptoms, any COVID-19 symptoms, which can actually be anything from gastrointestinal symptoms to shortness of breath, to a dry cough, to fatigue, chills, fever, making certain that really you keep your distance from those friends, loved ones who may have any potential symptoms. So finding now, of course, follow-ups for patients need to be done. If you're pregnant, there needs to be follow-up for you. Make sure you check with your obstetrician, check with your fertility clinic, and see when they can get to see you, so that also you're protected as well. So we have, for example, when we're seeing our patients, we have an area where no other patients are allowed, for example, and that's the place where we're going to see our pregnant patients or pregnant surrogates to minimize any interaction and maximize the distance between them and other patients. So speak to your fertility clinic, to your obstetrician, and definitely seek follow-up, and abide strictly by with social distancing. And also, if you don't have any essential work to do, or try to actually stay at home as much as possible to limit your exposure.
And I would add too, and I'd like to say how it's one of our Emily, who works at Circle, is listening in, kind of reminded me of something, that even if you can't travel to your surrogates, ultrasounds and scans, or whether transfers start happening, and same thing, most doctors are willing to have FaceTime or video the experience, so that then you can get the video uploaded. I know from our own, one of our own Circle employees who's going through the process. I watched his transfer at Dr. Danishman's office in the fall when we were there through video. So I think it's something you can start discussing with your surrogates and the IVF doctors, as well as our OBGYN, that if it's safer for you not to attend those meetings or those scans, to do it via video, which has been very common the last so many years anyway.
Very true. We have many intended parents, many patients who join us via Skype and via video for embryo transfers, for follow-up ultrasounds during pregnancy. So I think at this particular point, those are probably the best options to limit exposure. The other factor related to IVF is that after March 30th, if we're able to resume IVF cycles and egg retrievals, one of the options, if patients have restrictions on travel and not able to freeze their sperm, come to the clinic to freeze their sperm, then one option is to freeze eggs. I had given a directive to our IVF lab manager to look at the statistics for our egg thaw, egg freeze and egg thaw, and then subsequent development to the blastocyst stage. And the great news is that the rates are excellent. The survival rates on Our egg thaws are about 93%, and for all the fertilized eggs that we've had, about 65% of them have made it to the blastocyst stage. Those are excellent numbers, and it's an option. For example, if you have been matched with an egg donor, or you do match with an egg donor, but there's travel restrictions still remain and are in place, then we can go ahead and retrieve the eggs of your egg donor and we freeze them. Of course, patient safety is of the highest priority, so we want to make sure that we protect the health and safety of your egg donors. But that's an option if in the future some of the restrictions are still standing, and yet we are able to proceed with IVF treatment and egg retrievals.
The next question, I think we've answered this the last webinar, so right back to you, Dr. D. But Zika had an impact on fetal development. Do you know if it will be the case for COVID-19?
So far, if you look at the latest study that was published in the journal Lancet, there were a group of pregnant patients who were admitted to Wuhan University with who were diagnosed with COVID-19 pneumonia, and they had very severe symptoms. And what they did was they looked in those particular patients at cord blood, at the amniotic fluid, and then subsequently, once the newborns were born, they looked at nasal swabs and oral swabs, and they did not find any evidence of virus in any of those cultures. So at this particular point, with that limited study, there doesn't seem to be a risk of vertical transmission during pregnancy. However, the caveat is that that was a small study, so we have to take the results with a grain of salt and say, well, we are waiting for further studies, larger studies, to confirm this. The other factor is there's always a possibility that if a newborn is exposed to someone who has COVID-19 and or is shedding virus, the newborn could possibly develop symptoms and could be infected with the COVID-19 virus. That's a possibility. Again, there's a lot of unknowns right now in regards to the transmission of COVID-19. So we are keeping an eye on all the studies in all the major journals, including the New England Journal of Medicine, Lancet, the infectious disease journals, to find out more information. And as we have information, we will relay that information to you and to all of our colleagues who can then disseminate the information.
So there's a specific question. If someone's in a transfer cycle, transfer gets canceled, how does it work from a contracting standpoint? I mean, it's obviously based on your contract. It's probably best to speak directly to the lawyer on your team, but for the most part, if it's not the surrogate's doing, in a sense, if it's nothing, it's either you know, because of this or any other reason, usually she's owed what's called the cancel cyclation cancel. Which the cycle cancellation fee, as I trip over my own tongue, and you know, it would then kind of, the contract stays intact, and you just wait for the next time you can actually have a transfer. But if there's specific questions to your case, obviously you can ask directly to your lawyer, and they can speak with the surrogate's lawyer. But usually that's what happens in a canceled cycle case. Question: if symptoms are higher or worse for pregnant women, is it recommended that the surrogates stay at home and avoid people? I mean, I can speak in general. I think that's the recommendation for all people right now. In most, you know, we're seeing kind of shelter-in-place orders coming around the country where people are just supposed to stay home and stay in their yard. So I can let Dr. Danishman talk to it from a surrogate standpoint, but I think that's the kind of overall recommendation for everyone at the moment.
Yeah, I agree, Dean. This is a recommendation for everyone at the moment, and part of the reason is because that there are asymptomatic carriers of the virus. If you look at one of the latest studies, for example, out of China, about 86% of those patients who had severe symptoms with COVID-19 actually or contracted the virus from asymptomatic carriers. These were people who were shedding the virus, had no symptoms, were feeling just fine. And so there's that sort of 14-day period of time when patients can actually be shedding virus and be completely asymptomatic. So I think for pregnant patients, for everyone at this particular point, this social distancing and staying home as much as possible, limiting your exposure to people is the best plan. And I do think that based on epidemiological studies, when you look at other pandemics, for example, when you look back at the influenza pandemic, which had a significant toll back in 1918, those particular areas where social gatherings were disallowed had a much lower number of cases diagnosed each day, which lessened the sort of the strain and the pressure on the healthcare system. Those particular cities, like for example in Philadelphia back in 1918, where the social gatherings were not disallowed, had a much higher and exponential rise in the number of new cases, which really overwhelmed the healthcare system. So they had this very steep rise in the number of new cases. So this whole process of flattening the curve comes from previous data on previous epidemics, where if we can limit gatherings, social gatherings, we are going to limit the number of new cases, and that will eventually morph into a decline in the number of new cases. And I think there's good evidence for that, because when you look at China, when you look at South Korea, that's something that they've been able to do in terms of restricting social gatherings. And now the number of new cases, for example, in China, apparently are just the cases that are being imported, where other patients who are sick are coming from different countries. You take a country, for example, like Taiwan, who instituted these very strict measures very early on, despite the fact that they're about 81 miles with the bordering from China. The number of cases in Taiwan has been very limited, and the mortality has been very, very low. The number of deaths have been very, very low. They've instituted those measures very quickly, and in a short period of time, they were able to get a handle on the spread of the virus. So I do think that those measures are going to help, and I'm optimistic and hopeful that we'll be able to sort of get to that inflection point where the number of new cases will flatten and will decline in a short period of time.
There's a question asking if IVF clinics are still doing transfers to surrogates. I mean, I would venture to guess that yes, even though there are ASRM guidelines out there, they are not dictative or authoritative in the sense that they have any power to force people to stop. But I think most are stopping, and I don't know what your sense is, Dr. Donishman. I know you work at one clinic, but what it is around the country.
You know, in speaking to my colleagues, as you said, Dean, there is a variation. I think most clinics have delayed and put a pause on embryo transfers based on the American Society of Reproductive Medicine guidelines. Most have, but there are some clinics that have continued. However, even the clinics that have continued, I was speaking to actually a colleague last night. We were having a late night meeting last night with our team, and one of my good friends and the head of one of the largest clinics in the United States was letting me know that their now policy changed. They were doing embryo transfers, but now they're not going to. So this is this evolves every day. Obviously, there's also now restrictions on movement. Many governors in the United States are recommending, stay-at-home policies. So it is a fast evolving situation. I would say that the majority of clinics that I'm aware of have put a delay up until March 30th on embryo transfers, and then they'll reassess the situation after March 30th.
Dr. Donishman, do you have any thoughts or predictions on what the ASRM recommendations on resuming IVF will be after 3/30?
You know, I'm hopeful that the recommendations will be that the situation is now more stable and that we can continue at least to create embryos and proceed with the IVF cycle. But it really depends on the situation at hand, meaning that the number of new cases of COVID-19 that are diagnosed daily, the status of the healthcare within the U.S. in terms of whether it's overwhelmed or not with number of new cases. I think it all depends on that. So I think when you look at the health experts, what they're hoping is that in the next 2 to 3 weeks, they can really put a sort of a significant decline, a dent in the number of new cases by these social restrictions, social gathering restrictions. That's the hope. And I think that it's sort of the recommendations of ASRM is going to depend on the situation at hand. My hope is that, again, the situation will be better in 2 weeks than it is right now.
Dr. Danishman, we got information today that STFC is temporarily closing on March 27th. Do you have information about that?
We're not closing our office. However, we're not going to initiate any new IVF cycles or do any embryo transfers beyond March 27th. We're still available for consultation, but we, up until after March 27th, until we hear further from the American Society of Reproductive Medicine, we're putting a pause on new treatments. New IVF cycles, insemination cycles, embryo transfers, and any elective procedures such as hysteroscopies. We're putting a pause on that until we get further guidelines from the American Society of Reproductive Medicine, which will come on March 30th.
And after IVF procedures are allowed again, will there be a backlog impacting timing or affect timing?
I'm not anticipating any backlog affecting timing. We have an incredible team of close to about 100 team members, and with an amazing team of anesthesiologists, operating room nurses, and medical assistants. And I think that we'll be very, very well positioned to be able to start IVF cycles again. And there we have significant capacity to do so. We have 3 operating rooms, procedure rooms, so we will be ready if the number of cases are higher than average.
Okay. So this is a 2-part question. One's for Amanda and I, one's for Dr. Danishman. But so if an egg donor contract has an expiration date in the next few months, and there is a force majeure language, which this probably falls under, and we need to reschedule, does the contract need to be renegotiated or have an addendum? It probably doesn't, but it doesn't hurt to do it. So I think, reaching out to your team just to, get on the same page as the donor, just to say, if for some reason you can further it. I mean, you can have that conversation first, and we can reach out to the donor as well and just say, if there may be a delay because of this, is it going to impact, or we can add a specific addendum in, pushing it out a certain amount of time based specifically on the situation we're facing. If it might make you feel more comfortable to have an addendum that says, based on the current COVID-19 situation, it's more than likely that we won't hit the right expiration date, but we want to continue as a, continue the contract. I don't see an issue with that. And then I don't know if Amanda, if you want to jump in there at all.
I would say that now I'm tripping over my words. Just like we are facing with our surrogates and comments that Dean made earlier when we were discussing surrogate impacts and keeping matches together. I would say a lot of times our donors in these particular situations are, this is kind of a countrywide thing that we're facing as far as these delays, IVF center delays, things like that. So I can't imagine that we're in situations where donors would rematch with other intended parents and be able to cycle faster. So that is definitely, of course, a case-by-case basis, whether or not donors would be agreeable to amending contracts, as it always is with any particular situation. But as Dean said, it does make sense to begin those conversations for sure.
And then the medical piece, Dr. Danishman, and I don't even know if you've discussed this yet as a group, but basically the gist of the question is, since some states are being more proactive than others, and some states are being lax, and the governors are taking selfies out at crowded restaurants, is any thought given to the IVF facilities to only see surrogates or intended parents or donors from certain states versus others?
No, I think we have sort of the same guidelines for every patient, and irrespective of which states. I think it's important to note that if even when you have states that are stricter, let's say for example New York, one of the reasons is because just the number of cases in New York is significant. I think there are over 4,000 cases right now in the state of New York. So I do think that we all need to, as a society, help with stemming the tide of new cases. And I think if we do that, maybe for 1 or 2 weeks, I think we can make a dent in the number of new cases, and I think we can emerge stronger and move forward with hopefully gradually getting back to our daily lives. I think we just have to have these sacrifices, all of us, for the next couple of weeks, maybe 2 weeks, maybe 3 weeks. That's what most experts are talking about. And then a gradual sort of return to the normal semblancy of life.
There was another question, and again, this may have not come up yet at all, but is there any thought that the delays might be longer to save on medical PPE equipment, so that maybe IVF as a more elective procedure might get put on hold longer in order to conserve and/or supply hospitals with more PPE gear?
The reason for that hospitals have been told and surgeons have been told to delay elective procedures is so that those beds, hospital beds, are not taken by patients who are undergoing elective procedures that could be delayed without any, that are not essential and could be delayed without any harm to the patient. IVF centers have typically their own procedure rooms, their own surgery suites that are not sort of open, hospital beds for patients to use, who are ill. So they are in a little bit different category. If there are IVF centers that use hospitals for their elective procedures, then yes, that would definitely apply to them. This recommendation to delay elective procedures in order to free up more hospital beds for patients who are sick. But most fertility centers have their own independent procedure rooms, surgery suites, where those elective procedures are done, and those really can't be utilized for as a hospital in terms of a hospital bed for sick patients.
So question, thank you for the formative Q&A. We are intended parents with no friends or family in the US and are quite nervous. We're still only week 20. Should we try to get visa or similar? I mean, I don't think it hurts to start, potentially calling ahead. I would say everyone in Europe is entitled to that ESTA visa, which is 90 days, which I believe is shut down at the moment. But these emergency visas based on parentage, potentially you could at least start making the calls to the consulate, provide documentation. So, your team, I think we have one of our paralegals kind of going right down the line for births beyond June now and drafting these letters basically stating, you're in a surrogacy arrangement, you're the parent, etc. And it may be, even if you have contacts in your own government, your own country's government, to say, we're parents of this child to be born. We're going to need help potentially getting to the U.S. and getting back. I think that's the current little issue we're seeing now. And I shouldn't say little. The current issue we're seeing now is people not only coming to the U.S., but then potentially those who have had babies in the United States leaving to go home because there's a delay in passports from the U.S. And then some people are now just trying to go to their own country's consulate to potentially get passport or travel documents to travel on their own documents. But I don't think there's, not knowing what's going to happen in the next month or two or so, I don't think it hurts to start planning that, into that planning process quicker and see what happens. I mean, the worst case scenario is you go to apply now and they say it's too early or not at this time, and you just kind of, the routine then, and you can go back and forth to try and make it happen. Let me see. So one question in regards to Circle's financial statements. Small businesses are facing unique challenges, and I'd like to know if you expect impact on future business operations that could impact intended parents, given that many of us have made a very significant investment in our family building. Can you offer any information on that piece? I think this may have come before or after Sam had answered, and I don't know, he might have dropped, looks like he might have dropped off. But I see who this is, and I can have him reach directly to you. You can reach directly to him, but I think the position has been that we don't expect any issues at the moment, and that we plan to keep the full staff as is. I don't see any changes. As I mentioned earlier, we've been doing this for a long time without significant change in other economic downturns we've seen. So I think we're as solid as can be at the moment. So I wouldn't expect anything, but I noted down who this is because I can see the asker, and you can either reach directly to Sam or I can have him reach directly to you. Let me see. Do you anticipate resumption of egg retrieval and embryo transfer? I mean, we've answered this a couple different ways. After 3:30 is the major sole reason to discontinue these procedures at the moment to limit patient flow to the IVF clinics. I don't know if you want to answer that again, Dr. Danishman.
Yeah, I think the question is whether we are anticipating restarting IVF cycles after March 30th,
Yep.
and really depends on the guidelines or recommendations of the American Society of Reproductive Medicine, which will then also depend on sort of the then current status of the COVID-19 infections. I do think that if we see sort of a stabilization in the number of new cases or a decline number of new cases, then I think yes, we will start resuming in March 30th or soon thereafter. I'm hopeful that we will.
Okay. Question about surrogate has agreed to pump for us. Is that a concern if she's exposed after birth to COVID-19? I don't know if there's any studies on that yet, but Dr. Danishman, that might be in your wheelhouse again.
Yeah, I think at this particular point, no evidence that the virus exists in breast milk, but there's just not enough studies. I think there was one small study that looked at breast milk and did not find evidence of virus, but I do think that is not a study to be relied upon. So at this particular point, we don't know. That's a question. That's a very good question, and it's a question that requires further studies and further investigation.
So there's a question we kind of hit on already, but I'll answer. So it's a question about having a cycle canceled with donor eggs and donor retrieval, and wanted to know what's the best way to protect the contract. So like I said earlier, if you have a time limit on your contract and you want an amendment, just reach out to your team. I believe Amanda already mentioned, but most surrogates and donors are understanding at this time that it's out of both parties' hands why there's delays, and that leaving the contract they already have isn't going to mean that they can just go to another person and do a retrieval somewhere else. But if you feel the need that you want the contract amended and updated, just reach out to your team and we can make that happen. Have there been, this is probably for you, Amanda, have there been discussions ongoing about supporting our surrogates should they or their spouses temporarily lose their current income while having children at home full time, schools closing?
Yes, there has. I believe those are all questions that our social work team is kind of umbrellaing to all of our surrogates. What does this mean for you? You know, all of us here in the States are currently facing this situation as work moves to home and children are out of school. So those are all questions, lines of questioning that are being included when our social work team is in contact with our surrogates for ongoing support.
Does Circle have a policy on home births, especially if hospital wards are full of COVID patients, such centers of infection that, or such centers of infection that a home birth might be safer? From a legal standpoint and liability standpoint, we've usually had or have a policy against it. Even some birthing centers, mainly because if there's any issues with the birth of the child, or even the surrogate having complications, obviously you want them in a medical facility at its best. So I don't know if Amanda, you want to jump in there too.
I know the team, this is something that just right as of what Dean said, that, you know, it's one of those things that I think can be looked at on a case by case basis, but it generally speaking, when this has come up in the past, it is something that Circle as a whole is not necessarily against, but it's something that we would advise to have deliveries happen in hospitals.
I don't know, Dr. Danishman, if you have any inclination of whether or not, you know, most hospitals' maternity wards will be completely kind of sealed off from this area, or how it works from a hospital setting.
Well, in regards to how it typically works in hospital settings is that, you know, the filters that hospitals have for their sort of the air supply are the type of filters that can filter out, you know, viruses in particular rooms. At this particular point, I'm not aware usually the labor and delivery ward and the postpartum, in other words, after the babies are delivered, the wards are separate from the rest of the hospital. So when you go into a hospital, typically you have, let's say, 1 or 2 floors that are devoted to obstetric care, devoted to labor deliveries, and then postpartum care after the birth of the child. So they're already separated from the rest of the hospital in that regard. Overall, hospitals are at times can be riskier places because of the traffic and because of, you know, patients coming and going. But I do think now hospitals, especially in light of the COVID-19 infections, they are being extra careful, vigilant in terms of all, you know, cleaning surfaces and whether it's doorknobs and handles and all surfaces that where the virus could potentially be transmitted from. But typically the wards at hospitals are separated in terms of labor and delivery and postpartum care.
And I would also add that I believe this is why we're seeing the policies at the hospitals change. I mean, we've seen a few hospitals recently say that they can't guarantee more than one support person. That support person cannot change. Once that support person is listed and is in the hospital, that particular person would need to stay there. So I think this is why I think the labor and delivery units are taking every precaution they can to eliminate the virus being brought onto there, as Dr. Danishman explained, their particular units within the hospital.
And I would add to another piece that I should have mentioned, that I thank again my my peanut gallery on the inside watching this and listening to it, that insurance can cause an issue too. So if you know, your surrogate is insured and has coverage for the delivery, it probably won't cover in a home birth or maybe even a birthing center. So those are the other little issues to think about. I can also mention in Massachusetts, I know we actually, you know, to kind of get around this if issues arise, they actually dedicated one specific hospital in the Boston area solely for COVID-19 patients if necessary. So trying to eliminate the number of beds being taken up at other hospitals. So they tried to create a COVID-only hospital as of last week to be safe. All right. Given that elective procedures are being canceled, what is the recommendation on keeping or shifting dates of appointments. Not sure. I don't know exactly if you want to rephrase that question, maybe, unless Amanda, you can pick up on what it means.
Can you repeat it, Dean?
So it was like, given that elective appointments are being canceled, what is the recommendation on GCs keeping or shifting dates of maybe their appointments for check-in? They're probably 30 weeks or if it's for surrogates, normal routine appointments at their OBGYN, I don't think those are going to be changing because those are usually held at a specific OBGYN at their doctor's offices versus hospitals. So I wouldn't think it would be impacted, but I think that's what it means, Amanda.
Yeah, and I would agree with that, Dean. I think some of and Dr. Danishma might be able to comment on this further too, but I think some of the directives that we're seeing in regards to healthcare is that it is essential healthcare is remaining open and functioning. And OBGYN care, of course, would be considered essential healthcare. I think the healthcare that we're seeing more limited is elective procedures such as like LASIK eye surgery or something along those lines. So yes, it would be my understanding that routine OB care would be continuing and appointments would be kept on track.
Yeah, and same thing. And he further, if I read all three of the questions in a row, it was kind of, it made more sense. So I apologize, because then it asked if our 16, 20-week appointments being canceled, are they considered essential? So we're talking more of elective surgeries at hospitals. So hospitals can keep beds open if necessary for, more severe COVID-19 cases, not your surrogate's usual appointments that she's going to her OBGYN office. All right, traveling from the UK mid-June, under normal circumstances, can Circle help us arrange a visa extension for longer than the ESTA entry period if we arrive earlier? Yes and no, in a sense. I mean, we've definitely helped parents in the past where either they were waiting on legal work or a medical issue arose and they were stuck here longer. You usually have to go in person to USCIS, which is usually at any major international airport. They have an office. So what we've done for those couples that needed those extensions is we draft the letter, we put all the information in it, you have all that information, and then you go in person to that meeting. Right now, they're only taking emergency appointments, which means probably you wait till you're in that kind of last week of the extension. I'm gonna, I'd hate to venture and guess what this administration is going to do on anything, but I think most people that are going to overstay ESTA visas, it's not going to be their fault in a sense in most cases, and you'll have a very good story in a sense to tell that you came either early because of the birth or you're stuck here later because of travel getting home is harder. The worst case scenarios from an ESTA visa violation in a sense aren't going to be they're going to track you down and throw you out of the country without your child. It's going to be more of in the future, there's probably a 10-year, I think it's currently a 10-year dark mark on your visa status. So you probably you won't, in that period, you may not be able to get an ESTA visa. That doesn't mean you won't be able to get a visa to come to the United States. It just might be a little tougher. But again, we can help write that explanation letter, which I think in most circumstances, either you're going to get the extension, or if in the future you need a visa, that letter explaining that you weren't here and you wanted to extend your beach vacation. You were here because you had a child that you were the parent of that you needed to be here for, and that your delay in leaving was due more to lack of travel ability or waiting on a court order or something to that effect. Dr. Danishman, would you, in all likelihood, should we expect a ban on embryo transfers to extend for quite a while beyond March 30th, or do you have any knowledge of how long it would be?
It's hard to predict it because it seems like every day things are evolving very, very quickly. There's a possibility that the embryo transfers may, I mean, the American Society of Reproductive Medicine is not a sort of a policing force. They give guidelines and recommendations, and it's really up to each individual fertility center to take those recommendations and make their own decisions as to what they want to do. So I do think there's a possibility that that could be extended in terms of embryo transfers. I think the IVF egg retrievals will come back sooner versus the embryo transfers. So the embryo transfers may be extended by a few weeks, depending on how the situation is at the time on March 30th. Because of the nature of the IVF retrieval and the fact that sperm and egg are not affected, and there's no chance of transmission of the virus by a sperm or egg or embryo creation, I think that part of the IVF cycle or fertility treatment will come back sooner, and then followed by the embryo transfers. So just that's my understanding in speaking to one particular person who's on the COVID-19 task force, and we had a good discussion a couple of nights ago about their recommendation from the ASRM, and then also moving forward what their thought process is. And I will also just let you know that within a couple of minutes, I'm going to have to go to perform a procedure.
The question was, is egg retrieval currently allowed?
Yes, egg retrievals for patients who are already in cycle, who already have started or in the middle of their IVF cycle, is being completed, is allowed, and each fertility center has to make that decision based on the ASRM guidelines. But for us, for example, we are going to have a pause in egg retrievals after the 27th of March. And then we're going to wait until the 30th for the ASRM guidelines that will then let us know whether we can resume or we have to wait another week or two.
So there's a question about hearing that ESTA may not be valid at the moment. Can you clarify how we might be able to apply for a travel permit special visa? So there is another visa that people apply for to come to the US, and I think it grants longer than 3 months. It might even be 6 months. So, I think the way to do it is kind of through a special visa application through the consulate to say that, as I was mentioning earlier, kind of that travel letter that dictates that you're in a surrogacy agreement, that you're the parents, and that you need to be here for the birth. It's trying to make that application to the US consulate in your country to see if it helps. Again, we don't know if it will work. It may depend on who you get that day or at customs, but I think we can at least kind of explain what the process is, help you with any documentation you need, and then you can go in person in the sense, or call in advance, and if you have to go in person to the U.S. consulate, stating why you need the visa and why you need to get here. The issue, as I had mentioned earlier, I don't know if I fully explained it, with that exception I had said that we're trying to help people get through on, is it says you're the parent of a U.S. citizen. The question is whether or not they will consider a child who is not born yet to be a person or a U.S. citizen child. So even if you have the court order, will they accept that without the actual birth happening? So that's kind of that issue that many of us in this community are trying to figure out at the moment. The actual order that has these exceptions doesn't explain what the process is to use these exceptions. We've had a couple people just go to the airport and try and get on a flight and use try and get on a plane, get a plane ticket with those. But yeah. We have an expected due date at the end of August. We live in Canada. Would it help to petition CBP for a humanitarian visa now, or is that excessive? Is there a number we can call for help if there's trouble at the border? I mean, as I had said earlier, and you may have heard, I don't think it hurts to start the process now. I'm sure they're inundated anyway with calls and emergency meetings. So even calling now, for August might not be a bad idea, just because you don't know how quick things will happen. I think you probably potentially have an easier process in a sense being Canadian and coming here. So, but I don't think it hurts to at least to try that. And I can I can get you contacts if you want to reach out to your team. The Canadian attorneys may be able to assist. They may have contacts as well, because I'm sure they have parents that are doing surrogacy in the U.S. or overseas running into these issues. So, there's no negative to starting the process earlier than you expected. Let me see if there's any more. So that is actually all the questions. I'll thank Dr. Danishman and Sam, but they both had to do this. As I said, we'll try and update you as often as we can. We'll try and do this again. Your teams are fully immersed in these cases. Amanda's teams and the PC team are amazing. Our legal teams have, there hasn't been a time at night where I haven't been able to get in touch with them. We, as I mentioned earlier, we know you all expended huge investment in this process. We know that some of you have years of fertility ups and downs. We know that all of you are wanting to come out on the right side of this, and we want to make sure we help in any way we can to get you there. So know that we are working long-hour days, trying to get through as much to people in the community to get help, and we're there to help you along this process. I don't know if you want to say something as well, Amanda.
I just want to thank everyone. I mean, I know that we've had many of our intended parents, or it's a time of great stress. Many of our surrogates, it's a time of great stress. But through it all, everybody has remained having a lot of grace in the situation and having a huge understanding for the other people that are part of this process, such as surrogates understanding for intended parents understanding for their surrogates who are also in this with them. So it's a great thing to see how the Circle team is coming together. It's also a great thing to see how our extended family, as far as our extended Circle family, is coming together in support of each other, and working through all of the kinks in the system that we are currently facing.
Yes, and thanks for all who stuck through the whole time. As I said, we will be sending this out, so there's a recording being made. We have the page on our website. We'll keep updating you as much as possible, but please reach out as questions come to your own case. Have a good night, morning, day, wherever you are. Try and keep the news off if you can. Try and focus on the positives, as we're all trying to do here too, and we'll assist you as much as we can. Thanks.
Thank you, everyone.